And thank you all for coming. Tonight's speaker is, I should ask you how to say your last name. Nicole Pelliciari, who is a BCBA. She has over a decade of experience in the field of behavioral health. She is a master level clinician and is also a board certified behavior analyst. She has experience in a variety of clinical settings, including residential facilities, outpatient facilities, homes, and school districts. She currently provides on-site consultation at CNNH and develops and oversees ABA therapy programs, provides supervision for bachelor and master's level students who are getting their clinical hours, and provides behavior services in various school districts, assisting in program development and staff training. And she's going to tell us a little bit about what ABA is. So please welcome Nicole.
Okay. All right. So thank you all for coming out on a Tuesday night. I'm sure you've all had a long day to start. But how many of you are familiar with ABA? Have some idea of what it is? Okay, so some of it. Okay, that's a good thing. Before we jump into ABA, I'm just going to tell you a little bit about where I'm from and what we do. So I'm a behavior analyst at the Center for Neurological and Neurodevelopmental Health. We are a multidisciplinary practice with our primary specialty being neurology. And then we also offer psychology services, behavior services, and creative arts services. We provide evaluations and we provide treatment. We offer treatment for a wide variety of diagnoses. We see, especially in applied behavior analysis, my end of it, the bulk of what we're seeing in terms of diagnosis is autism. But we do get a variety in terms of ADHD, ODD, anxiety. I always joke and say anything that ends in a D is likely to come our way. And we also see individuals who don't have a diagnosis but maybe have some behavioral challenges. So today, because it is April, it's Autism Awareness Month, a lot of what we're going to cover in what we're using in ABA is going to be geared towards individuals who have an autism diagnosis. And just to define autism, it is a brain-based disorder. We no longer segregate it into autism, PDD-NOS, or Asperger's. We now have autism mild, moderate, and severe per the DSM-5. And we know that autism is associated with a number of different challenges that could be medical, that could be genetic, that could be physical, sensory. So we're going to talk today about how ABA can be used to address some of these challenges. And then these are just some basic statistics. We know that the autism numbers are growing and they are rising. So ABA. What is ABA? It's using principles that have been empirically supported to make systematic changes, functional changes, meaningful changes in the lives of those that it's being implemented in. We use direct observation. We use different measurement. We're very big on data. We believe in motivation and reinforcement. And that's going to be something that's going to resonate through a lot of what we're talking about today. And at any point, if you guys have anything, if you have a question, if you have an experience, and it's not on this PowerPoint, throw it out there, because if I can offer you feedback or answer any questions, I'm happy to do that. We don't have to stick to this PowerPoint.
No, I do have one question.
Sure.
You gave a statistic on the occurrence of autism in boys and girls.
Yeah.
I understand that the data on girls is changing.
It is. It's rising.
Why is that so, you think?
Why do I think? That's going to be a question for research and genetics. I think we also have to take into consideration, we see that the research implicates age of mother and father, and people are starting families later in life. There's more use of fertility treatments that may or may not factor into some of the diagnoses and things of that nature.
But they could have more of an effect on boys than on girls?
I don't know.
I understand the ratio of girls may be higher and closer to boys.
Mm-hmm. we're getting there. We do have a lot of girls that have a diagnosis of Rett syndrome, right? And Rett syndrome falls under that umbrella of autism. So it could be how we're diagnosing is also changing, in addition to the environmental factors and the medical factors. So, but there is a growing number of girls. Yeah. So we talked about this. Who can benefit from ABA? ABA is not a pigeonhole treatment. A lot of times you hear it associated with a diagnosis of autism and skill development in autism because that's our primary population, that's our primary patient base. But like I mentioned in the beginning, we can implement ABA across a wide variety of populations and diagnoses. Some commonly used strategies. You may have heard these, especially if you're familiar with ABA, and we're going to talk about some of these today. Everything from reinforcement to activity schedules to functional communication to data collection. Those are all big markers in ABA and very, very significant in our treatment. I'm going to start by talking about motivation. Because motivation, it really is the heart and soul of ABA, and that's why I have it up there. It helps us understand why individuals engage in certain behaviors or why they respond to certain interventions or certain types of programming. And it helps us understand what's keeping that individual going, whether it's for positive behavior or negative behavior. Is it attention? Is it access to an object? Is it escape from something? Do they need a break? So motivation, understanding why an individual is engaging in an activity that they're engaging in is very, very important. And that leads us to reinforcement. Oftentimes in behavior, and you'll see I have a few slides up here, behavior analysts kind of get a bad rep sometimes for reinforcement. We often get asked the question, why can't this individual just do it because that's what they're supposed to do? I get that. If I had $1 for every time I got asked that question, I would be a millionaire. And it goes back to understanding that we're all motivated by something. So what is reinforcement? It's any stimuli, any event that increases the likelihood of a behavior occurring again in the presence of that stimuli. So here's an example. A funny video my friend showed me wasn't funny and I laughed. Suddenly, my friend shows me more videos because they liked the response of laughing, right? The laughing was reinforcement for that individual. The laughing was motivation. So here's just a little flow chart, right? You have the behavior, you have the response, which is the immediate consequence, and then what happens, the next result? You're having more of that same behavior. We use reinforcement in a very, very varied way. They can be tangibles, it can be attention, it could be food items, it can be sensory input. And we have different schedules that we use with individuals. Some individuals have secondary reinforcement in the form of tokens or points. Other individuals get access to that immediate reinforcer, that actual tangible object or that actual response from the individual right away. We want to make sure that we're using reinforcement that is motivating to the individual. We'll talk about that too, because oftentimes people won't use things that are motivating for the individual. They haven't taken time to do what we call a preference assessment. See what that individual likes. They may use something that they like. And this goes back to what I was talking about in the beginning with reinforcement, where behavior analysts get a bad rep sometimes. And you can see the examples. Why isn't this individual just doing something because that's what they're supposed to do? And I like the example with Willy Wonka because I hope you expect to go to work and your boss doesn't pay you. For those of us that go to work, I love what I do, but it's a really nice incentive, right? We all love what we do. It's a nice incentive to get your paycheck every 2 weeks or every week or whatever it is. That's a schedule of reinforcement. So it's very, very important to know what motivates somebody and what reinforces the appropriate behavior that we want. That leads us to what's the difference between reinforcement and bribery. That's another thing I hear a lot. You know, oh, you're giving this individual something, you're bribing them. There's a big difference. When you're bribing somebody, you're giving them the desired interaction or the desired item before they engage in the target behavior that you're looking for. Reinforcement always occurs after that behavior. So it's a first then kind of mentality. First, you use the bathroom, then you get 15 minutes of game time. Not the other way around. If you do game time first, then you go to the bathroom. Does that make sense? Pretty clear, right? Pretty basic. Another thing with reinforcement, we have schedules. You have some individuals that are earning reinforcement on a very rich schedule. Say, like, I have some kids that earn every 2 minutes if they have a calm body and calm hands. And I say kids, and I shouldn't say kids, because I have individuals that I work with. My youngest is 2, my oldest is 24. So if the individual isn't engaging in a behavior that is maladaptive, like aggression, and they are engaging in something that is appropriate and functional, like communication, then I'm going to catch them being good. And that's something you can do at home. That's something you could do at school. That's something you can do in a clinic setting. Oftentimes, when I'm in classrooms, and I used to teach kindergarten, long time ago I taught kindergarten, and now I go back and I look at my own behavior. We always tend to give a lot of attention to the individuals that are engaging in the maladaptive behavior, right? The kid that calls out, the kid that gets out of their seat. They're getting all the attention. Let's catch those other kids being good. Let's put those other behaviors on what we call extinction, right? So let's ignore them and let's catch the other individuals being good and reinforce them with something that motivates them so that we can increase the likelihood that that same positive behavior will occur, and maybe the other individuals in the room will observe that and notice, hey, you know, this guy's getting something good for following the directions. That whatever that individual's getting has to be able to compete with all of that negative attention. Any questions here? Good? Okay. Just one more thought on reinforcement. This is huge, like I touched on earlier. Different strokes for different folks. Just because you like M&Ms doesn't mean the individual you are working with likes M&Ms, right? Or if you're doing shower time or bath time with, say, a child at home and they really like Dragon Ball Z, but they've watched it all day, and you say, oh, you get to watch more Dragon Ball Z, that might not be motivating for that individual at that time. They may be satiated from it. So really understanding what's going to keep somebody going, what's going to keep somebody's motivation up is very, very big. So that's how we're going to start today, just knowing that everything we're talking about is going to incorporate some type of reinforcement somewhere. So that brings us to, how does ABA work? ABA is a series of events if it's done correctly. It starts off with an initial assessment. From that initial assessment, we can develop an intervention. Intervention requires data collection so that we can understand, is our intervention working? And then responsive programming. So it's not a one-shot deal. It's not a one and done with ABA. Our biggest goal is to determine the function of behavior. And I like this, it's all fun and games until someone figures out the function of your behavior, because then we learn and we understand, how can we motivate you, how can we get you to engage in that appropriate, that functional response, and how can we decrease that maladaptive behavior. So understanding function of behavior is something we're going to talk about in a little bit more detail as we move forward. like I said, assessment is ongoing. This is a big thing too, especially if you're in a school district or if you're receiving home services or clinic-based services. If you have an assessment and that assessment hasn't had a concurrent review or a concurrent treatment plan in at least a 6-month period, that's a red flag, because we want to make sure that we're staying on top of our data, on top of our programming. And 6 months is a long time. That behavior can change. Environmental variables can change. Medication can change. Hormones can kick in. There's all these different things that affect your treatment. So assessment should always be ongoing. And I use the frame of 6 months because right now on the healthcare end of things, insurance is using a 6-month standard. But any of you that have received services or participate in services, deliver services, you know it's going to be very, very important to not just wait for that 6-month period. If you have data collection at the end of the month, that's an assessment. You should be asking to see your child's data or your student's data. That data should be graphed. It should be explained. There should be a conversation about it with whoever's involved. Could be a teacher. Could be the teacher and the case manager and the family. Could be the therapist, the BCBA, and the registered behavior technician. But I can't drive this point home enough. Always, always, always assess. When we're assessing, what are we looking for? We're always looking to understand the function of the behavior. What's causing it? What's maintaining it? Before we can get to the tried and true function, there are things that we have to take into account because there are things that influence why individuals engage in the behavior that they do. Variables that aren't reinforcement, other variables. Things that can be out of our control, like genetic explanations, past experiences. Do we have an individual who has a diagnosis, but also has a trauma history? That one is actually very, very important, and I can share an example with you. I have a little boy who is now 9 years old. When he came to us, he was 3. He had just turned 3 years old. And he has a diagnosis of autism. He also has a history of in utero drug abuse. So we have, in addition to the autism now, we have another confounding variable, right? He had physical abuse. He had verbal abuse. On top of everything else now, this individual has a diagnosis of autism. We would have therapy sessions, and I would have him at 3 years old, 4 years old, 5 years old. It wasn't until probably the last 2 or 3 years that the behavior started to dissipate. This individual would run back and forth and slam himself into the walls and then hide under a table. And as he's hiding under a table, he's yelling profanities like you've never heard out of a 3-year-old. A 3-year-old shouldn't be exposed to the things that this kid was saying. As a behavior analyst, what do? What's the function of that behavior? It's not escape. It's not for attention. There's other things going on there that are related to that trauma history. So if you leave here with nothing else today, when you're working with families, with individuals, kids, adults, that understanding that their past experiences and their trauma, so significant. Because we have to deliver not only the evidence-based treatment that we get from science, but we also have to be empathetic and treat each individual with their unique needs and for their unique needs. So yeah, that's a big one in my book. The immediate environment. So what's going on? What is that? What's going on in that individual's world every day, at the moment, before they were with you? It can be people, it can be activities, it can be routines, it could be illness. That is sometimes a variable that we can manipulate. And that's something we're going to talk about when we get into talking about functional behavior assessments. Okay, so now that we have an idea of what could potentially cause behavior, now it's important for us to figure out, okay, we understand the causes, we have an idea of what's going on. What's the function? There are 4 primary functions of behavior, and I like this because I even use this with my students. It's just an acronym everybody eats: escape, attention, tangible, sensory, or automatic reinforcement. So what is it? When we have an individual that's engaging in escape or avoidance, they're usually engaging a behavior to get out of doing something or to end a task early. A lot of times you can see this behavior in classrooms. If somebody's being presented with a non-preferred task, they would rather engage, some individuals, in maladaptive behavior. You could tear that paper up. You can crawl under the table. You can try and elope from the classroom. So escape and avoidance. Attention. We have some individuals that have a hard time with communication, right? We have a lot of communication deficits in autism. So oftentimes you may have somebody that's engaging in maladaptive behavior to get your attention because they don't have a replacement skill. God bless you. They don't have a replacement skill to appropriately get that attention that they're looking for. Tangible, access to an item. And then sensory or automatic reinforcement. Is there something going on in the environment, or is there something going on internally that oftentimes is something we can't see or may be beyond our control? That's where that sensory and automatic reinforcement piece comes in. Any questions on functions of behavior at this point? Pretty clear? Okay. How do we know the function of behavior? You're going to hear me say 100 times tonight, data, data, data. Data collection is huge. We have to understand what happens before that maladaptive behavior. So what's the trigger? What's the antecedent? And antecedents aren't always what people typically think of. You know, oftentimes people will say, oh, the individual was told no. How did that individual sleep at night? Depending on what area we're in or what population we're working with, did that individual have breakfast? Did that individual have a meal over the course of 24 hours or 48 hours? Those are all things that can be considered antecedents to behavior. And then the behavior itself, and then the consequence. Is the consequence attention? Is it escape from something? Is it positive? Is it negative? Consequences don't always have to be negative. That's another question we get a lot. Well, consequences are bad. Not always. Reinforcement is a consequence. It's a positive consequence. So we have to look and see what kind of consequence is maintaining that behavior. So data is big. And again, the point I would ask you to take away from this, if you're a provider, if you're somebody who's receiving services, if you have any type of ABA programming that you're involved with in your life, data. Data, data, data. Any ABA program should be based on data so that we can make those responsive changes and engage in that responsive programming. Yeah.
Talk about the first. Now, how do you go about collecting data? And you mentioned several examples of data, but how do you go about collecting it? How do you know what data is most important for that particular individual?
That is a really good question. So that's where we have to do our functional behavior assessment. That's actually the next couple of slides. So in our assessment, our functional behavior assessment is comprised of interviews, it's comprised of observation, it's comprised of interaction with the individual that we're looking to develop programming for. And once we have that solid observation and we can see, okay, behavior X occurred at this time. What was happening at this time? There was a transition. So we know that transition, a change in routine, is causing the behavior. Well, what's maintaining it? Every time this kid transitions and he flops or she flops, he has 3 people over him or her saying, come on, stand up. Do you want this? Do you want that? So observation plays a key role. And then the intensity of the behavior, the frequency of the behavior, that's going to dictate what kind of data do we take. Do we take frequency data? Do we take interval data where we're not doing tally marks? Frequency is where we have those tally marks. If we have behavior that's high intensity and high frequency, the reality of that frequency data being valid is very, very low. So you can take data, but the key to taking data, that's a great question, is taking the right data and understanding why you're doing what you're doing. A lot of times, too, you have to make sure that your data collection is fitting into the lives of the individuals that you're giving that data to, because the behavior analyst and the therapist, they can't be in somebody's home 24 hours a day. They can't be in somebody's classroom 5 days a week. So when I'm in a classroom, I might have interval data where if a behavior occurs in a 2-minute interval or a 5-minute interval, I'm going to make a mark in that box, and then I'm going to do my antecedent and my consequence. Okay, what happened during this interval, and what were the response of the others in the environment during this interval? But if you're in a classroom with an individual or in a home with one child or multiple children, regardless of age, and you say to a parent on top of everything else they have to do, here, listen, I'm only in your house, 10 hours a week. All the other times you have to take data. I'm not going to ask a parent or a teacher to take data in intervals of 2 minutes or 5 minutes. It's unrealistic. So a lot of times when we're having teachers and parents take data, we'll ask them to take data 3 days a week, and we'll extend the intervals. So I'm going to give you an hour interval. If something happens, you're only marking it one time. Not every time it happens, like frequency. So observation and understanding what you're looking at and what you're looking for. This is also where records review come in. Interview with the significant individuals. That functional behavior assessment is going to dictate how you take your data. And then the outcomes of that data, they're going to dictate, do you continue to take data the same way? Do you change how you're taking data? It goes back to that responsive programming. And we kind of talked about this, right? The trigger, the behavior, and then what happens. ABCs. Okay, so this, we just covered a good chunk of this. Functional behavior assessment. It's a chain of events. Like we said, there's an interview, there's an assessment, and there's a ton of data. Typically, a functional behavior assessment is completed by a BCBA or a BCABA. And if you're not familiar with the difference, the only difference is the BCABA is a bachelor's level clinician. I can't talk anymore today. And the BCBA is a master's level clinician. Both are trained or should be trained to complete a successful functional behavior assessment. The length and time and number of days of the assessment, it's going to vary. I can tell you that when we go into schools, one of the contingencies I have to get a real read of the individual, I need the hours to add up to at least one full school day. But you want to be there more than one full school day. So maybe you do a 45-minute observation in the morning, one day. And maybe in the middle of the week, you do another 45-minute observation. Maybe at the end of the week, if that's the most challenging time for the individual, you spend more time in whatever that setting is on a different day. So my rule of thumb for an ABA from start to finish, 10 to 12 hours. Anything less than that, you're not going to get all the information that you need. And that's not just the observation, that's interviews, that's doing your research on paperwork, if there's IEPs or 504 plans or prior medical history that you need to be aware of. So that's going to be an important part, that records review. So what does it do? It helps us identify, go ahead.
I just had a question. When you're doing FBAs,
Yeah.
and it was requested by the school because the behaviors are being exhibited at school.
Yep.
Do you ever go into the home also? Like if there is carryover into the home, is it across multiple environments or is it one?
If the behavior is occurring in multiple environments, then the FBA should happen in all the environments that the behavior is occurring in. Because there may be, the trigger to that behavior may be the same, or it may be different, or maybe what triggers that behavior is the result of something in one environment that gets carried over into the other environment. So if there's behavior occurring, and it's across environments, whatever setting it's happening in, yes. Always yes. It is common, and oftentimes This is where it kind of gets tricky. It's common, but depending on, this is where we have to look at budgets and things like that. Now, this is reality. Because as the behavior analyst, there'll be times I say, well, we have to talk to the parents. We have to do a little bit of an observation, sometimes in the community. Like if there's behavior happening at Friendlies that's the same as at school, I would go to Friendlies. And the school district may say, or the parent may say, or whoever the funder is may say, nope, you have X amount of hours and we're only funding it for here. We want all the hours here. That's where oftentimes we hit a roadblock. Science and treatment and outcomes hasn't yet quite meshed with everything else. So we're getting there.